is Dr. Carol Francis Talk Radio, and it reaches about 1 million people, and we really just want you to speak your heart.
Okay, I'm going to speak my heart. Medicare for all, or single payer, universal health care, has always been a priority, I don't want to say political, priority subject. I believe that everyone has the right to health care, no matter where they come from, what station of life they are, and how old they are. We all deserve the right for health care. And right now, I am going to be going to another rally this afternoon at the Mann's Theater in Hollywood, and unite with the nurses. I believe that their title is the United National Nurses Association. They have been on board with Medicare for all for a long time now. They're going to do their best to get it for all of the nation, but here in California, we're going to try to get Medicare for all right away and be an example for the rest of the country. It is the priority of this country. Where this goes, everything else follows. Everything, creativity, productivity, everything goes. If you have your health, my father always says, you have everything, right? But if you don't have your health and you don't have health care, you have nothing.
You feel like it's a constitutional right?
Oh, I believe it's a constitutional right. It's a basic human right. It's a United Nations right. It is the right of a human being. That's all there is. It's a constitution. Like I said, get the politics out and off of our bodies. Yes, absolutely. This is not a political issue. This is a human right.
And for those senators and congressmen that are voting against ACA, what's your message?
My message is that I'm a middle-aged woman, okay, and I've been to Bernie Sanders rallies, and like I was telling these people here that have been elected as Democratic delegates for their districts, when I came out last week and voted for these young people and people that want a progressive movement throughout this country, I'm going to tell you right now, they're moving for that progressive movement in the Democratic Party, and you corporate Dems and the old Dems that have some of those Dems voted against prescription drug
Big Pharma.
Yeah, Big Pharma last week. They basically betrayed the rest of their party and betrayed older people, the elderly, betrayed everybody in this country by voting that down for ridiculous reasons they said about that they were afraid of safety issues. Drugs from Canada, really? Safety issues? Please. Okay, we know who stuffs your pockets. But the fact is that there's going to be a progressive movement with Bernie, without Bernie. It's here, and there are people. There are young people of all colors, of all heritage backgrounds. They're getting together, and they're going to move through. And we're going to change. We are going to change the landscape. We are going to change this country. This country.
We can easily distribute information.
We're going to be better.
And the nonpartisan, the Republicans that were protective of the ACA, the Democrats protective of ACA. It's a nonpartisan decision. It should be.
It should be a nonpartisan. And those people those Democrats, those politicians are out there trying to protect it. We need to expand it. I believe they need to get on board with Medicare for all. They need to get on board with a single payer basic program that, basically ACA has to, if they cannot basically convert that into a Medicare for all, they need to just basically go that way. It's the only thing that will make it possible. And I want to speak to other people that, I know there's people out there have the sentiment that it's an entitlement, that health care is an entitlement. Like, I worked my whole life and I worked and I got a job and now I have health care and you didn't work your whole life. Well, there's people that take different paths all around the world, all around this nation. Some people can work part-time while taking care of children or taking care of their older family, They're taking care of their mom and dad and they're taking care of their kids at the same time. And they're maybe working part-time. They don't have the availability for health care, okay? There are people out there, maybe they don't work at all for whatever reasons. Maybe there's something within them that they're not working at all. And we all want everybody to have a job and have that purpose in life, right? But there's all different reasons why Why? And I want to tell you those people. Some of the people that you know, and maybe you yourself, will be losing your job. You'll absolutely be losing your job because the ACA almost actually has become the New Deal, okay? And the New Deal basically put everyone to work, okay? And they put over 3 million jobs over the nation. They made those jobs. The ACA created those jobs in the medical, in the healthcare system. Those jobs created to help other people with their ailments, to help other people with their care. Those jobs were created. And now all of those jobs are going to go bye-bye. What happens to our economy then? What happens? It's all integrated. It's not just forsaking somebody else's health insurance. It's forsaking people's jobs. Healthcare is a right.